February is American Heart Month, an important reminder to prioritize heart health. And here to tell us all we need to know is Dr. Gavini from the Cardiovascular Institute of the South. Thank you so much for joining us today.
Thank you so much for having me and giving me this opportunity to reach your audience.
Of course. So what is heart disease?
Heart disease refers to the process of plaque and fatty buildup inside the vessels that supply your heart muscle itself. That term is considered atherosclerosis, and this basically happens across someone's lifetime, and it results in narrowed vessels which decrease oxygen-rich blood that your heart needs to function normally.
So what are some of the overall symptoms of heart disease for men and women?
So the most common symptom is chest pain, chest tightness, and that pain can look very differently in people. It can be sharp, it could be dull, throbby, achy, sometimes even a burning-like sensation. People can also have shortness of breath, chest tightness, or even nausea, vomiting.
And people may have some of these symptoms and not feel like they need to go to the doctor, but it's important that if you feel these symptoms that you do reach out to a professional. What are some of the overall risk factors for men and women?
So I'd say first and foremost, aging is your first risk factor. This is a process that occurs across someone's lifetime. So typically after the age of 65 is the most common time that people start to develop issues because you've simply been around long enough for the plaque buildup to start causing problems. Second, I would say smoking. This is a really important risk factor to talk about because this is one that is what we consider to be a modifiable risk factor because this is something that's in your control, specifically nicotine use. So nicotine in itself causes spasm of the vessels, causes inflammation to the insides of those vessels, and can really accelerate that plaque buildup.
Those are all very important. Does your diet play a role?
Absolutely, it does. Diets that are very high in saturated fats, unnecessary carbs and sugars, high in salt. Salt is important because it can prompt the development or worsening of high blood pressure, which is another important risk factor. High blood pressure, particularly blood pressure that's not well controlled, also plays a role in inflammation of those vessels and stiffening of those vessels to, again, promote cardiovascular plaque buildup.
And a lot of people may have some of those symptoms or pay attention to some of those risk factors, but some people may say, I'm not going to get, heart disease. It comes from my family. Let's start busting some myths around heart disease. Can heart disease come from your family?
Absolutely, it can. So another risk factor that I find to also be probably the riskiest risk factor is genetic family history. And this is specifically referring to a genetic reason to have uncontrolled high cholesterol. So oftentimes we see patients, they're not obese, they're not smokers, they're not in fact older than 50, yet they have uncontrolled cholesterols. And so this is not necessarily driven by the diet, but this is a genetic reason that your body is unable to process cholesterol. And because there's so much of it, it accelerates how quickly it builds up in your vessels. So that's very important. And this is, I would say, sort of the most dangerous risk factor because unless you're screened and unless you know, these populations can have what we consider to be premature coronary artery disease.
Wow. So fact or myth, if someone has heart disease and it comes from their family, there's nothing they can do about it.
That's definitely a myth. So again, getting screened early to ensure your cholesterol levels are not through the roof, to basically figure out whether this is genetically mediated, because unfortunately for those people, the diet really does not completely impact their outcomes. These are the people that need to aggressively start medications, particularly cholesterol medications, early on in life. And the sooner you do so, the sooner you are as far as a longevity when it comes to mortality and heart disease across their life.
So within that family makeup, there's men and women. Is it a fact or a myth that heart disease is more prevalent for men than women?
So this, in fact, is also a myth. It's a very large misconception surrounding heart disease. And there's been a lot of effort to go into changing this. For a very long time, a lot of the research regarding heart disease has predominantly been surrounded by men and how it presents and what the outcomes are. But this is something that has more recently been changing. More women than men actually die of heart disease, particularly over the age of 65. And anatomically, women are different. We have smaller anatomical coronary arteries. These are the vessels that supply the heart. So that does play a role. And we also have different phases in life, such as menopause, puberty, and hormones, and things like that, pregnancy, that affect how heart disease plays out in women.
And so one of the important things that you kind of talked about was chest pain. Is it a fact or a myth that chest pain is, one of the only signs of a heart attack or heart disease?
That's also a myth. So chest pain can look very differently, or chest pain equivalents of what we like to call them. Some people don't actually have chest pain. They may only have shortness of breath that comes on disproportional to what they're doing. They may have nausea, vomiting. They may have dizziness. They may have palpitations. They may break out in a sweat, or they may have right-sided pain, even though your heart lays on your left, or just back pain that comes out of nowhere, associated typically along with other symptoms like heaviness or tightness, nausea, vomiting, those types of things.
And some people may feel those symptoms, some people may not. Is it a fact or a myth that some people believe they don't need to see a cardiologist until they're of older age?
I certainly feel that that is a myth. And the reason being, as a preventative cardiologist, ideally, or I guess in an ideal world, we see our patients prior to an event. There's so much power in prevention. Yes, we do see patients during an event in the hospital, and then we take care of the acute problem and follow them to help mitigate the recurrence of another event. But seeing someone sooner so that you're able to look at your individual risk factors and what you can specifically do. So I would say there's not a specific age, but certainly if you have risk factors like diabetes and high blood pressure, if you are a smoker, or know of strong family history of heart disease, so parents or siblings and things like that, very important to see a cardiologist sooner than later. So I really encourage my patients to come in prior to symptoms.
Prevention is so important, and sometimes people don't know exactly which doctor to see. Is it true or a myth that pain in your legs or another part of your body isn't directly correlated to the heart?
So that one is also a myth. And the reason being, let's say you have pain in your legs, and this is due to that same atherosclerotic plaque buildup in your vessels, specifically your arteries in your legs. That is peripheral arterial disease, and in fact, a direct risk factor for coronary artery disease, because this plaque buildup can happen in any arterial bed. So when it's in your legs, we call it peripheral arterial disease. When it's in your coronaries, that's coronary artery disease. When it's in your carotids, that increases your risk for stroke. So that's also a myth.
A lot of different things to pay attention to when it comes to your body. Let's get into smokers. Is it a fact or a myth that if they quit smoking, they put it down, it won't actually affect if they have heart disease or have a heart attack or not?
No, this in fact is also a myth. When it comes to smoking, we think that once the damage is done, there's nothing that can be done about it. Well, in fact, the sooner you quit smoking, the sooner you keep exposing your body to nicotine. It really is very powerful as far as what it can do for your long-term mortality and further development of heart disease. So the sooner you quit, the better. And the other, I guess I'll jump into, myth is that vaping is not a healthy alternative by any means to smoking. They're equally damaging to your heart health.
That's so important to note. Some people think vaping is better, but it's good to know the facts surrounding that. So what about high blood pressure? Is it true that you'll always be able to feel high blood pressure?
That is also a myth, and no, you don't always. Now, some people do have headaches that come out of nowhere. They may have never had a migraine or headache history, and that's due to high blood pressure. Some people may get a heaviness in their chest because of uncontrolled blood pressure, but hypertension is truly considered the silent killer. Most people do not have any symptoms whatsoever, and that is why these preventative visits are so important unless you have an ability to check your blood pressure at home. Because how often is it you go to the physician and your blood pressure is elevated? Because those can be uncomfortable environment. So there is such thing as white coat hypertension, where it's situational high blood pressure, but that may not be truly reflective of your overall blood pressure. So no, you may not have symptoms, which is why it's important to get screened. And if you don't have a way to check your blood pressure, to ensure that you do go either to the physician or even, stores like Walgreens and things like that. They have little stations where you can check your blood pressures. Also, community screenings. There's quite a few available where they do blood pressure screenings, because people quite literally can have hypertension and never know, unless, they show up with a stroke. And that is the single most important risk factor when it comes to stroke.
I do believe this is truly life-saving information. Someone can be tuning in. They may have a family member that they're looking after, or even themselves, and they may not have even thought about their heart health, but your heart is so important. It literally keeps us alive. What would you say to Ascension residents who may be iffy or unsure about seeing a cardiologist? What guidance do you have there?
I guess first and foremost, I'd like to let them know that you are your most important asset. Being an advocate for yourself and for your health is so very important. Listen to your body. Trust when you feel that something is off, because symptoms can be so silent, so variable in people. There are so many community opportunities as far as screenings at CIS. We have a Prairieville location, a Baton Rouge and a Zachary location, and throughout the year we offer multiple completely free screens that you're able to sign up for. Oftentimes people find out about conditions that they have that you would have never otherwise known that you have. And I would say, whether it's a cardiologist or your primary care, just be diligent about staying on top of annual visits, because it's these regular visits that stay on top of diagnosing diabetes, cholesterol issues, high blood pressure, and those types of things. There's resources in the community, and you should certainly take advantage of them.
Thank you so much for joining us. This is, again, life-saving and life-changing information, and we look forward to having you next time.
Thank you so much. I appreciate that.
Of course. So like Dr. Gavini said, be heart healthy, take control of your health, and listen to your body. If you want to learn more about this, we'll have some information on your screen of contacting the Cardiovascular Institute of the South. We'll see you next time.